Now, other aspects, of course, cover problems breast cancer patients may have according to age. Breast cancer occurs particularly in elderly women, but also in women who are at the beginning of their careers, of their lives, and of their family planning. So these two pillars, elderly women on one hand and young women on the other, have to be discussed thoroughly, and it has to be discussed how these patients are being treated. Of course, society is aging, and that is the reason why women in higher age who might develop breast cancer should be treated accordingly and in the best possible way. And we know that there are obstacles towards this treatment because elderly women do not receive the same kind of treatment and very often are not being treated identically as women of a younger age, although they would be fit and although they would be have an adequate organ function to receive the same kind of treatment as younger women do. We know, and it was shown during the conference, that elderly women are being very often treated in an adequate way and should receive optimal treatment, where their physicians should consider at least contacting oncologists, at least offering best available treatment, and at least discussing these options of best available treatment with these patients. On the other hand, very elegant results during the conference were shown on the question whether women who are young and fertile can be pregnant and can become pregnant after having developed breast cancer. We know from earlier results from the GBG that early breast cancer is not a contradictor to become pregnant and to have a good result of these pregnancies. Now, these results were widened by results that were shown here, by data from Belgium and other countries, where patients with estrogen receptor positive breast cancer were analyzed for the potential of pregnancy to influence either in a positive or in a negative way the outcome of breast cancer. And it was found that in a number of patients which exceeded by far the 1,000 mark, women with breast cancer and estrogen receptor positivity did not have a detrimental effect from having a pregnancy after the disease. It was surprising to find that breast cancer, which was estrogen receptor positive, was particularly positively influenced when the pregnancy occurred rather early after the diagnosis of this disease. So we are having truly two different answers building upon the age of women who are suffering from breast cancer and who are able to lead relatively normal lives after the discovery of this disease.